No state or nation or any country on the planet can live with the Delta variant when our vaccination rates are so low. Because if we chose to live with this while the rates of vaccination is at 9%, we will see thousands and thousands of hospitalisations and death.
Lockdown restrictions for Greater Sydney have been tightened after New South Wales recorded a concerning 44 new COVID-19 cases. 29 of those cases were either partially or fully exposed to the community. There are now 14,000 close contacts and 10 people, including people in their 20s, in intensive care. As backlash mounts over handling of the Southwest Sydney outbreak, the government has announced New South Wales will receive 300,000 extra vaccine doses. The boost in vaccines is aimed at tackling a growing number of infections that has millions of residents in lockdown and on edge.
New South Wales is facing the biggest challenge we have faced since the pandemic started.
Case numbers have continued to rise despite sweeping restrictions, with the New South Wales government now implementing stricter lockdown measures. Both the state government and Scott Morrison have been slammed for initially resisting lockdown in the face of the highly contagious outbreak.
The challenge we've had in New South Wales is compliance with those restrictions. I mean, people can be wise after the fact, but equally, the idea of when a lockdown should have been put in place, is an arguable point at that time. The virus doesn't move on its own. It moves by people moving the virus around. And that's why it's so important that the restrictions that have been put in place, that are appropriate, just need to be complied with.